Initial investigation report of a case of pneumonitis infected by a new coronavirus in Zixing. At 1600 on February 1, 2020, Zixing No. 1 People's Hospital monitored a case of Wuhan Huizixing patient who had a fever of 37.5 degrees Celsius and no cough and sputum symptoms. At 1700, he was admitted to the hospital for inspection and expert consultation, and the results of the consultation could not rule out a new coronavirus infection. At 1700 on February 1, the epidemiological investigation team of the Zixing City Center for Disease Control and Prevention conducted an epidemiological investigation and instructed the hospital staff to take samples. The investigation is reported as follows: Basic information. He Shalwat, male, 42 years old, Han nationality, 431,081,197,711,177,517, teacher of Wuhan Shuyi University. Living, 303, Unit 3, Yating District, Dongjiang Street, Zixing City. Telephone, 18,995,637,110. He usually lives with his wife Hu Yanhong and his son He Mayang. From February 2019 to January 20, 2020, the patient and wife Hu Yanhong and son He Mayang came to Wuhan to live. Address: Room 402, Building 5, Gate 5, Luyan Bay, Nanhu Fenghua Xintian City, Wuchang District, Wuhan City, January 21, 3 a.m. Many self-driving private cars returned to Zixing from Wuhan, and returned to number 303, Unit 3, Yating District, Dongjiang Street, Zixing City at 1300 on January 21, accompanied by their wives and sons. Past history, none. 2. Onset and diagnosis. He Shalwa reports that at 3 o'clock in the morning on January 21, a self-driving private car returned to Zixing from Wuhan, arriving at 1300, and his companions had their wives and sons. She had no fever, cough, sputum and other discomfort after arriving in Zixing. On the evening of January 28, He Shalwa took his body temperature. His armpit temperature was 37.20 C, and he felt weak. On February 1, Zixing's big data comparison found that He Shalwa had appeared in the South China seafood market in Wuhan, and the exact time was unclear. Considering the high possibility of exposure, he was found to have fever 37.5 degrees Celsius and cough during the transfer to the isolated place. Immediately 120 transferred to the First People's Hospital of Zixing for treatment. Admission blood test routine, WBC, 6.48*109 per liters, L, 1.44*109 per liters, L, 22.2%, N, 70.8%, CT results showed scattered infection in both lungs. At 1719 on February 1, experts from the First People's Hospital of Zixing consulted. A suspected case of pneumonitis with a new type of coronavirus infection was reached. At 1800 on February 1, the patient's throat swab specimen was collected from Zixing CDC, and sent to Luzhu CDC for detection at 8 o'clock on February 2. 3. Epidemiological investigation. Possible source of infection. The patient lived in Wuhan for a long time, and had a Wuhan life history 14 days before the onset of illness. 2. Judgment of close contacts, follow-up and investigation of the activities of the patients before and after the onset of the case and the contact of the crowd. 29 preliminary contacts were determined through preliminary investigation, and they were family members, medical workers, and one staff member of Chowco Forest Farm. It has been in contact with the patient without effective protection. Among the close contacts who have been tracked and managed, the patient's mother has mild cough symptoms, and the others have no abnormalities for the time being. C. The action trajectory is as follows. From February 2019 to January 20, 2020, the patient and his wife Hu Yanhong and son He Mayang came to Wuhan to live. Address: Room 402, 5 Building, Luyan Bay, Fengtian Xintian City, Nanhu, Wuhan, Wuhan. At 3 o'clock in the morning on January 21, a self-driving private car, EA3DJ23, returned to Zixing from Wuhan without wearing a mask. At 7 a.m., alighted to the service area of Yueyang City, Hunan Province, and went to the bathroom. He arrived in Zixing at 1300, did not eat during the period, and ate snacks brought at home. At about 13:30, I got off and bought 3 toothbrushes at Dongjiang Swanfu supermarket. The stay time was short and no mask was worn during the period. I went home for lunch immediately, and there were 3 family members with their mother and nephew. On the evening of January 21, I went to dinner at 201, Unit 1, Building 8, Lin Hai Villa, and his contacts were, the patient's family of 3, his mother, nephew, and his brother's family of 3. At about 2100 after dinner, the patient's family of 3, her mother and nephew drove back to Unit 303, Dongjia Yating District. At 9 o'clock on January 22, a family of 3 and their mother and nephew drove a private car to Tongko Forest Farm for Chinese New Year. From January 22 to 24, I stayed at my sister's house, Yaiko Forest Farm. During this period, I didn't go out in contact with other staff in the Yaiko Forest Farm. On the afternoon of January 24, I went to the Tongko Forest Farm office to fill in the form, and during the period, I contacted the Liko Guang staff at the Tongko Forest Farm office. After eating lunch at 11 o'clock on January 25, the patient drove his mother, son, sister and nephew to Xiaoshu's house in Lutang Group, Zixing Village, Chaoko Town, and went to the Dashu's house to celebrate the New Year, drinking tea and chatting together. Greetings. At 1700, I will return to my sister-in-law's house for dinner. There will be the patient, his mother, son, his sister, nephew, sister-in-law, son-in-law, daughter-in-law, and watchmaker. After dinner, the patient drove his mother, son, sister and nephew back to the Tongko Forest Farm. On January 26, the patient drove alone from Chaoko Forest Farm back to Unit 303, Yating District, Dongjiang Street. At about 10:30, he arrived at Zixing Lin Hai Hotel and contacted his friend Qi Hongfei's family of 5. On January 16, Qi Hongfei's family of 5 flew from Wuhan to Japan, from Japan to Changsha on January 25, and then took the high-speed rail to Luzhu, arrived at Zixing on the afternoon of the 25th, and stayed at Lin Hai Hotel. At about 11:30, the patient drove Qi Hongfei's family back to the downstairs of Dongjiang Yating District. The Qi Hongfei's family of 5 drove the patient's vehicle back to Wuhan. During the period, Qi Hongfei's family wore N95 masks and gave them a N95 mask. The vehicle was driven away by Qi Hongfei. He Shalwa ate instant noodles at home and bought side dishes once while wearing N95 masks. On January 27, he Shalwa lived at home cooking at home. Did not go out and did not contact other people. On January 28, his wife, son, mother, nephew, and sister rented a van, license plate Shangle 14931, and returned to Unit 303, Yating District, Dongjiang Street. From January 28 to 31, he stayed at his home 303, Unit 3, Yating District, Dongjiang Street, Zixing City, and did not go out and did not meet anyone. At 1600 on February 1, 2020, 120 patients were taken to the First People's Hospital of Zixing for treatment. The patient did not wear a mask during the downstairs from home and did not touch anyone during the period. 120 wear a mask. At about 1640 after the initial diagnosis, the nurse was guided to take the patient for a CT of the lungs. After seeing someone waiting, he went directly for a blood routine. The blood was taken and tested by the examination department Fan Danja, and both parties wore disposable surgical masks. Then go for a CT without having anyone in contact. There was no communication with the guiding nurse during the consultation, and both parties only wore disposable masks. After CT, the patient refused to be hospitalized. Tang Xiaowen, Hu Dezu, Ou Jiong did ideological work with him. During the period, a mouth angle occurred. During the period, the staff only wore disposable masks, and the contact distance was about 1 meter. 4. Possible close contacts, see Annex 1. 5. Sample collection and testing. At 1800 on February 1, Zixing City Center for Disease Control instructed Zixing People's Hospital to collect specimens from patients' throat swabs. At 2200 on February 2, the City Centers for Disease Control and Prevention's new coronavirus nucleic acid test result was positive. 6. Preliminary investigation conclusions. According to the on-site epidemiological investigation, clinical manifestations, and laboratory test results, this case is in line with the confirmed case of pneumonitis associated with new coronavirus infection, based on 1. The patient had a Wuhan residence history 14 days before the onset of illness. 2. Patient fever 37.50 C. 3. Patient cough and sputum, CT of the lungs, little infection in both lower lungs. 4. Blood routine, number of white blood cells, 6.48 109 per liters, number of lymphocytes, 1.44 109 per liters, percentage of lymphocytes, 22.2%, percentage of neutrophils, 70.8%, 5. Pharyngeal swab laboratory nucleic acid test result is positive. Diagnosis of suspected cases of pneumonia consistent with the new coronavirus. 7. Measures taken. 1. At 1700 on February 1, the patient went to the Department of Infectious Diseases of the First People's Hospital of Zixing for isolation and treatment. After consultation with experts, suspected cases of pneumonitis with new type coronavirus infection were not ruled out, and direct online reporting was made. At 1720, the staff of the CDC organized an investigation team to conduct an epidemiological investigation on patients and instructed its Dr. Li Ya to collect the patient's throat swabs. At 8 o'clock on February 2, Zixing CDC took the patient's throat swabs. Specimens were sent to Quzhou CDC for testing. 2. On February 1, the expert team of the Zixing City Center for Disease Control and Prevention guided the investigation and disposal of the epidemic situation, and identified close contacts. Troubleshoot and observe the situation of medical isolation at home, and pay close attention to the health status of the close contacts of the patient Hishalwa. 3. At 1400 on February 2, the staff of the disinfection team of the Municipal Center for Disease Control and Prevention disinfected Hishalhua's family in the middle and late stages, and instructed his family members to do routine preventive disinfection. IV. After 2200 on February 2, after receiving the positive report of the nucleic acid test result of Hishalwa from the Luzhu Disease Control Center, our center promptly informed the doctor of the First People's Hospital to revise the suspected case report to correct the confirmed case of new coronavirus infection pneumonia mild cases. At the same time, public health emergencies were reported online and not classified. At the same time, the work plan for the classification and treatment of pneumonia outbreaks of new coronavirus infections was immediately initiated. 5. Active symptomatic treatment. The patient continued to be treated in isolation at the First People's Hospital of Zixing City. The isolation treatment was performed until the respiratory symptoms completely disappeared. The city's disease control center followed up the patient daily. Next steps. 1. Continue to track and investigate the activities of patients, investigate close contacts, and implement home medical observation and timely feedback of close contacts in accordance with the management plan. 2. Strengthen the management of hospital pre-screening, triage and fever clinics, and strengthen the protection of medical personnel. During the routine diagnosis and treatment, the awareness of diagnosis and reporting of pneumonia cases of new coronavirus infection should be increased. 3. Strengthen publicity of pneumonia-related prevention and control knowledge of new coronavirus infections in the whole region. Zixing City Center for Disease Control February 3, 2020.